If you're anything like me, we've treated our symptoms, yes, women's symptoms, like mysteries, when the truth is they are often patterns.
My co-founder had migraines where she would lose her vision every month or two. And doctors are looking for brain damage, they're looking for eye damage, they're looking for different disorders. Not one person asked her, when in your menstrual cycle does this happen?
I'm Brenda Armstrong, and today I am joined by Aagya Mathur, CEO of Aavia. She is building the hormone intelligence layer of healthcare and helping women walk into appointments with answers. Thanks for tuning in to Redefine Her. Let's do this. There are 2.1 billion people in their reproductive years globally, and most of us were never taught how ovarian hormones affect sleep, injury risk, muscle tone, mood, digestion, or focus. But damn, do we feel it. After her own what in the heck is happening to my body moment, Aagya Mathur set out to change that. She's the co-founder and CEO of Aavia Health, and she's building what may become the hormone intelligence layer of healthcare. So welcome to Redefine Her. I'm so glad to have you today.
Thank you so much for having me. And I am very excited to be here and honored to be here. Excited for our conversation and to see where you take us.
Me too. I was doing research as I was sharing before, and there's just so much to cover. So let's dive right in. Women historically wait 7 to 10 years on average for diagnoses of conditions like endometriosis or PCOS. From your perspective right now, how many women are being treated for anxiety or burnout when really what they're experiencing is likely hormone driven?
We actually have a medical advisor who is a reproductive psychiatrist. How we worked with her to develop our PMDD flagging in our app, for example. So PMDD, for those who don't know, is premenstrual dysphoric disorder. And it's a mental health condition that's driven by your hormones at the end of the day. So instead of it being clinical depression or what people consider to be regular depression, it typically spikes during specific times of your cycle and gets a little bit better. But what she was seeing was that when people would come in to speak with her about their depression, she'd ask, how often are you depressed? When was the last time you were depressed? Because it's something that's so overbearing. It just feels like I'm always depressed. I'm always anxious. I'm always whatever it might be. And she would have them go away and track for the next 14 days, next 30 days, and then the next 60 days, not to question them, but just track for me. How often are you depressed? On a scale of 1 to 10, how does it feel? Things like that. And so she was able to then see, okay, for this person, this is actually PMDD. For this person, it's actually depression. And without having those patterns, for psychiatrists, thankfully, they have a little bit longer of appointments, but you only can go off of that and provide care based off of that. And so that has really helped.
That psychological load is huge when you don't know why you feel off, but you feel off all the time. I think we end up blaming ourselves for something that is actually within us, but somewhat out of our control. When did you realize that this wasn't really about period tracking, but more so about quality of life and really the impact on women's day-to-day?
Starting Aavia and my whole journey really started because no one told me the whole truth about my own health. I have my own experiences that drove me crazy. What's going on? Why is this happening? And why are people not telling me what's going on, what should be actually normal, whatever it might be? And I'm a science nerd. So I studied neuroscience in undergrad. I took the MCAT, thought I was going to do my MD PhD. My mom cried the day I told her I wasn't applying to med school. I think she's gotten over it now. And I started looking into it myself to be like, what does the research say? First of all, we all know that research in women's health is very limited. I started looking into myself to understand what's going on. Why is this happening? And came across the world of ovarian hormone health. And that's when I was flabbergasted to learn that our ovarian hormones don't impact just period and fertility. impacts quality of sleep, quality of muscle toning, energy levels, sex drive, skin, mental health, mood, risk of injury. So Aavia is not and has never been a period tracker. It's always been a hormone health app and is now actually a hormone health data layer for across the board as well. We have about 85 million longitudinal data points over just the last 12 months. And when you think about, we've been around for a couple of years, and then people also import up to 10 years worth of data from other apps when they're transitioning over. It is really a wealth of knowledge that we've learned from. We've been able to improve our algorithms. That's how we can help people with flagging their hormone conditions as well, and so much more.
We go to our doctors with these symptoms and we feel like we're crazy, but they send us home with a birth control or Xanax, or they tell us to get more rest. And we've maybe spent 15 minutes with them. And as you referred with psychologists or therapists, those appointments are longer, but our primary care physicians, it's quick. You're in and out of there.
Sometimes
15 minutes max. And it's not always with our doctor. That time is not spent with our doctor. It's someone else. But when you look at it, symptoms of perimenopause and menopause and any hormonally related conditions are super subjective. Every person experiences these symptoms so differently. Yet there hasn't been a standardized way to track these subjective systems and identify patterns in mainstream healthcare. But there are, of course, millions of biomarkers. They don't actually equal the brain fog, cravings, irritability, any of those things. And even for myself, it's been this ridiculous shoulder pain and joint pain and shingles at 37. Who has that? It's torturous. But what do you think that insiders miss about this subjective data?
A big part of that is, actually said this yourself, of there are so many biomarkers, there's so many lab tests you can take, but two people can have the same amount of estrogen, but your body metabolizes it, processes, and reacts to it differently. And so we need to understand that we can't capture the brain fog, the shoulder pain, the irritability, the cravings, the energy dips, your bowel movements through these biomarkers and with these sensors and things like that. And so I feel like the industry is pretty obsessed with a lot of these things, quite frankly, but no one's really asking, how do each of these things make the person who's living with these lab results actually feel? And what do we do with that information? And so that's where we have really made that decision to focus on the lived experience. We call it our hormone behavior data, to understand how you feel, what your digestion is like, what your mood's like, what all these different subtle changes are like, because no two people are going to feel the same things, but we can find patterns within your own data. And that's where we can actually predict within Aavia through your earlier years, from menses, which was at puberty, then getting into your late teens to your early 20s and so on. We really focus on, okay, your sleep does change week over week. Your energy levels do change week over week. It doesn't really at that point matter what your estrogen levels are. But if we know that, and then we can predict that, also give you recommendations on what to do about it. And so this is where it's like, yes, we can measure everything that's going on in the biology, but each person's experience is personal, and bringing those two worlds together is where the magic happens.
Aavia Health is at the intersection of lived experience and science.
Yes.
Hugely impactful. It sounds like you are building this intelligence layer of healthcare. Medical care is so expensive, but we're living in a sick care system. We're not treating our health from a preventative angle. So ultimately, with Aavia flagging various hormonal conditions like PCOS or PMDD and others, these things take a long time to diagnose, but you guys are able to capture this in 3 to 6 months. That has to reduce the costs overall, especially if you can capture something early and treat it early.
Oh my gosh, absolutely. And that's something I really think that talking about the overall costs of things is something that we don't do enough of in women's health, but that is what will help us get on the bigger healthcare map at the end of the day. But just for any of these conditions, 7 to 20 years to diagnose, that also increases your risk for other conditions. So for PCOS, for example, PCOS, the longer it takes to diagnose, the higher your risk is for heart disease, for fatty liver disease, for diabetes, for a number of different things. And then that means you then are starting to go to more and more doctor's appointments. That's increasing the healthcare costs. That means you're taking more time off from work. That's decreasing your productivity. And then if you get diagnosed eventually with these as well, that's an additional cost. So all of these things, it's cyclical at the end of the day of the longer it takes you and your doctors to figure out that you have a condition, the more you're at risk for these other conditions, the more that you're spending going to doctors. And then we haven't even talked about the psychological load of that on yourself. Like, what's going on? Why is this happening? Why am I feeling like this? I feel like crap. And then it's also affecting my relationships, which then makes me feel even worse, all of these things. And so how do we reduce that? That's where we really create a snapshot, and we worked with doctors on what does somebody need to bring to you to help you in that 15-minute appointment. They bring something to them that takes them 60 seconds to scan. You might be going to a doctor who doesn't even know what PMDD is, or doesn't know that these different conditions can be a thing. So then we have a whole section for physicians on how to help them. There's just so many different layers, and we have to play in all of them, from the education to the patterns to the flagging, because without one of those, it can easily get skipped.
Most definitely. That's like where the impact is long term. If you looked at corporations, if they really actually calculated the cost of productivity in the workplace, as well as healthcare costs that are tied to hormonal dysregulation, do you think that incentives would change faster than policy?
I would hope so. It's a matter of enough people need to ring that bell to bring it to their attention. We know from our member base that over 42% of them miss 5+ days of work based off of their symptoms every year. And that's a lot. Can you imagine? I want to go on vacation,
I know,
not
not
be
lay in
sitting at
bed.
home, whatever it might be. Hopefully somebody has sick days, but oftentimes we don't have sick days. You're using your paid time off for this, and you're missing work on days that are unexpected. So then that's harder for teams to cover for, whatever it might be. And I do believe that, at least from the employer standpoint.
51% of our population are women. So it impacts everybody in some regard, whether it is your colleague at the office who's not able to show up for a million reasons, or your family, or your children, or extended resources within your community. It goes so much deeper. Motherhood in America is at a breaking point, and moms deserve to tell the story. Moms First is a national movement fighting for affordable childcare, paid leave, and a culture that truly supports families. And now they're launching a documentary about motherhood in America. And they're inviting moms across the country to become associate producers of their film. Because for too long, other people have defined this narrative, and it's about darn time that we reclaim it. You can become an associate producer by sharing your story with the Moms First team. Just visit momsfirst.us to learn more. And let's make sure moms are the ones telling our stories. That's momsfirst.us, momsfirst.us. The healthcare wearables market is projected to surpass $100 billion globally. So there's HRV, there's glucose spikes, there's all these sleep stages that are highly measurable with these wearables. I don't know if we're doing enough to take action on that measurable data. And not only that, but people don't always know what to do with that data or how to interpret it. Aavia isn't just an app. Tell us more about what you have created for people and the inside scoop.
Aavia itself, for the consumer, it is a app where first and foremost with education, we really believe that there's this intersection of education plus patterns that's really important because we were never taught that our hormones impact so much more. And thankfully now, especially with the younger generation, there's less stigma. They're much more open to talking about these things, learning about these things, doing something about this. And they're much more proactive as well, which we love to see. Aavia first starts with the education side to help you understand, hey, your cycle is much more than your period or getting pregnant, trying not to get pregnant. And these are the different things. And in the app itself, we'll take you down 2 different pathways depending on what you've already told us about you. If you already have certain symptoms or you've been diagnosed with a condition, whatever it might be, you're the next step up in terms of education, in terms of knowing that, okay, this is already cycle related versus if you're somebody who's like, something's wrong, I don't know what's wrong, then we'll take you down a different pathway with more education and helping you understand. But regardless of who you are, we then really start to personalize your experience from day one. So because we've had so many people in the app, different ethnicities, different ages, different conditions, we from day one can say, okay, based off of what you've told us in onboarding, this is what you may experience. And then as you get further and further into your experience with Aavia, we say this is what you will experience because we know from your personal patterns. But then it doesn't just stop there. It's like, okay, this is what you're going to experience. We're predicting your symptoms or your high energy or your great workout day. So the good and the bad. We also from there give you recommendations, which then help you make your bad days better or to optimize your good days as well. So this could be everything from these are the days you have really poor sleep and therefore take magnesium to hey, you seem to have these different symptoms that could align with BV or a yeast infection or STI. Here's this company we've partnered with that you can actually get a test from right away. And so we do the full gamut and we really focus on the data, on the software experience. People come into our app on average 4 times a week. So just being a period tracker. Then also our top 10% of people log every single health indicator every single day. And that is where we just get more and more personalized. But for us, our focus is really on the software, on building the best product we possibly can, but then partnering with all the right brands, products, services, whatever it might be, who is doing what they're out to build really well as well. So that could be from telehealth to the tests that I was mentioning to wearables, whatever it might be, so that we can bring this whole ecosystem together and really create this women's health hub. I know I already shared that we also flag different health conditions and that we also have a section where we pull out your health trends so that your doctor can look at it very quickly. But we also have a community forum that's very buzzy where people come in and they're very open. I'm this many years old. This is what's going on. Does anybody have feedback? Or does anybody have suggestion? Has anybody been through this? Really keeps you from feeling alone or helps you feel validated or helps you get the insights that you would like right away as well.
Yeah, and as you've said, you've collected over 85 million points of data and then integrating that and bringing more of a holistic view that really does remove one stigma, but the loneliness and isolation of having these symptoms because it's a shared experience in a way. One thing that is coming up though is reproductive data pretty politically charged right now. How do you build trust with your users?
Oh my gosh, Brenda, trust and data privacy is what we lead everything with. That's so important to us. Early on, we spent a lot of time on building that trust and
Yeah.
knowing what our stance is on things and our policies and things like that, but then also maintaining it now over time. And that's something that I think a lot of people don't recognize the value of, quite frankly, of not selling your members' data, not sharing it widely, like whatever it might be. And that's something that we really focused on in terms of ensuring that our policy is very sound. We have literally one person who can possibly access the data, and it goes through 3 different layers of checks before she even can. And the only reason she does is if our members need help. Either they're like, hey, I lost all my data, or I want to delete my data, whatever it might be. But also we have anonymous sign-in. So you're not even connected to your data. We also have opportunities to do the Apple Relay. So then it's not your email, just different opportunities for you to make sure that you know that we care. And people take to the internet for it. There's been different scandals with other companies, with other health apps, and they will on their own, without us saying anything, take to the internet to be like, this is why I trust Aavia. You should switch to Aavia, whatever it might be as well.
That has to feel good, really is reinforcing the work that you're doing and how important it is, creating this ecosystem where trust is built in and people can find answers. If you could summarize or create one power statement, if fully integrated into healthcare, what does Aavia become?
Big part of this would be that it does become the lived experience, the hormone behavior layer. A lot of people are doing the biomarkers, they are doing the sensors. You talked about wearables, but let's bring these things together. And while we're a small but mighty team and we move as fast as we can, but it's also bringing in so many different things versus having Aavia available for you to connect the dots on your ends is something that would be really powerful. Another element of that becomes how it unlocks different elements for our members as well. So if you're going to your doctor and they're already trained on Aavia, that's allowing you to get that diagnosis, get better care. We've already had about 12% of our members self-report that they have gotten better care at their doctor's office. It's what Aavia is meant to be. It's meant to be connected into the overall healthcare system and not be a standalone. But I also believe that about a lot of women's health. We need a lot more collaboration, partnership. All of us are doing what we're doing really, really well. And now let's bring those things together so that our members can benefit. They can have better outcomes. We can have a greater impact together.
Most definitely. There are so many different women's healthcare companies that are doing incredible work, but we have to somehow collate this to make the impact more effective on a bigger scale, right? Allow increased funding, create more awareness around this, which we're in this world, so we're talking about it all the time, but how many people do you connect with? And that's the last thing on their radar.
Absolutely. It is the world that we live in. And an example I always think of here is when someone says, oh, this is something I'm going through. I'm like, why haven't they heard of this company? But there's also a discoverability problem, quite frankly. The reason we even started working with other brands at the get-go was because our members were asking us that question. Hey, you recommended I take magnesium. What magnesium should I take? Who can I trust?
Where can I get this? Yeah.
Exactly. You're telling me that I have symptoms of BV. What do I do about that?
And there's so much on the socials. There's so much
Yes.
misinformation out there. The elder Gen Z generation who are now in the workforce. I think the years that they were born is like maybe 2004 to 2017, something around that time. In any case, they're like 14 to 29 now. So the elder Gen Zs are in the workforce.
Yes.
But this is a generation that has grown up with smartphones. They've grown up with AI, instant data at their fingertips, but still never taught how their own hormones affect their daily life. Do you think that the Gen Z generation will demand hormone transparency the way that millennials have demanded mental health transparency?
I love this question. Hormone health is where mental health was 3 years ago. Because of TikTok, there's been this democratization of education circa 2020, 2021, where it really started taking off. With that came a lot more awareness that our hormones impact so much more. Before 2021, you never heard anybody saying the word luteal. You
Right.
never heard anybody saying, oh, it's my hormones. We had an entire campaign saying hormonal is human. And people really loved that because they're like, yes, it's my hormones. It's not me. And so I truly believe that that's where they have gotten a glimpse of that. And now this is where they're saying, I am going to take care of my body. They're much more proactive about
Yeah.
health for preventative health over just reactive health. We partner with a company that does egg freezing. A lot of them, even before you're eligible for that, are interested in learning more because they're like, oh, this is something I should be aware of and I should be considering. Then we worked with LabCorp, where order your own lab tests. They're like, I want to know what's going on. There's just so much more proactiveness there and willingness. There's a wearable company I was speaking with, and their largest growing population is 18 to 25, even though this is a multi-$100 product. And so this is what they want and what they demand. And I don't think big healthcare is there in understanding that. And they don't trust big healthcare.
Right. So it's a double-edged sword because they are investing in their health and well-being, but probably the big companies don't think they have the money to invest in their well-being. So unfortunately, a lot of these big companies, it does become about money. And so you're targeting your buyer. But the reality is they are tuned in. They are
Yep.
definitely tapped into what they want. They know what they want. And hormone health it's human, like you mentioned. It's important to them. It influences things like cardiovascular risk, and heart disease is the number one killer in women. Why do you think that overall we're still siloing women's health to just fertility?
I wish I had an answer to that question. And if I had an answer to that question, I'd work to help solve it. A big part of it is that is where healthcare believes all the money is. And unfortunately, money talks. I also believe that once a woman has heart disease, it gets into reactive healthcare, sick care. Why do we need to figure out what's going to cause it? Why do we need to figure out anything that could help prevent it? Because that's just not where we're focused. I literally was building artificial arteries in undergrad. That was my thesis because heart disease runs rampant in my family. It's just something that I care a lot about. And I know that the symptoms are different for women. It presents differently when you're having a heart attack in women. It then impacts you differently, all of these things. And there's actually a company also out of MIT that is building a smart bra to help detect these. But it's like, why are we not focusing more on that when it's the number one killer?
Yeah. Good question. There's so much opportunity in the cardiovascular space in women's
Yes.
healthcare. These diseases are affecting us younger and younger too. And whether that's environmental, the layers are just so many and it's very complex. Women's healthcare has been dramatically underfunded, under-researched, and even more so for founders of color. Kesia Coleman was just on our first episode launch for season 2, and Kindred is her company, and we were talking about people of color, Black women. They have more severe consequences from lack of health care. So much of that is based in, unfortunately, prejudice and racism. And then when you look at the funding around all of this, funding for people of color and Black women's healthcare companies is even less. And you studied fundraising as a first-time female founder. Give me your approach to how you have gone about fundraising for Aavia.
The stats speak for themselves. It's women and then women of color. The numbers are just really, really low, really, really bad. We're actually known to drive more results with even less money as women and to have great impact. It just continues to boggle my mind, but I know that there's bias, there's prejudice. When I was at MIT for my MBA, I did an independent study under Kit Hickey, who is one of the founders of Ministry of Supply. My study was on how to fundraise as a first-time female founder. To boil it into a couple of points, this was almost 10 years ago. So just keeping that in mind, markets change, all of that happens. But a couple of things that really stood out from that I used in my own fundraising journey as well. One is there's actually a Harvard study on this, that regardless of if you are a female speaking to another female or a female speaking to a male investor, they're going to ask you more of what have you already done, rather than if you were a male founder, they're going to ask you, what are you going to do? But you can flip that narrative. Oftentimes they don't even remember what question they asked you. So if they're asking you, how much money have you made? Respond and say, by the end of this year, we're going to make X, Y, Z. And really making it forward looking, because that's what they're attracted to anyways. That's what they should be investing in. That's one of them. Another one being that just knowing your numbers inside out. I was in the Entrepreneur Center at MIT as well. One of our guest speakers who came in and said that the founders, whether male or female, that impress them the most are the ones who can be like, this is what our retention is, 6-month retention, 30-day retention. This is what conversion rate looks like. This is what click-through rates look like. This is how we're improving our click-through rate to our conversion rate, like whatever it might be. And knowing those numbers inside out, not being timid about it, also not apologizing for anything. I did this and I've done a really freaking great job getting here with the very limited time and resources I've had. This is how we would take your investment and grow from that and make this even better, things like that. Another one, honestly, which is so interesting that came up, I spoke to a lot of founders or female founders who had raised their first rounds, was on how to dress. Oh, I thought that was so interesting to just hear them say, don't wear anything revealing. Those things should be pretty intuitive, I think, but also like that shouldn't matter.
Like you've got to wear the power suit to be an equal player. And also so that they aren't presuming anything. It's just ridiculous. Like we are all humans living in this world, and yet women have to do so much more to overcome these objections.
100%. And, another two things is I remember multiple female founders telling me, I wasn't married at the time, but them telling me, if you're married, don't wear your wedding ring. Because then they're going to be like, are you trying to have kids soon? And they'll ask that. And they make assumptions about that, the way that you're going to then not be as committed. But I have so many founder friends who have had kids and crushed both, had kids while running their companies. One other was also on, if you have a male co-founder, to take your male co-founder with you, or to have another male investor vouch for you, or whatever it might be. And it's like, again, your impact, your results, your qualifications should really stand up for themselves. But these are the things that I did them, because if it's going to help me, I'll do it. And we always led with MIT founders. And I know that that's a privilege that I had to say that, because with that, Stanford, MIT, Harvard, whatever it might be, that really carries weight for a lot of investors, which I totally use that.
Yeah, definitely. And why not? You really need to. And yes, it is a privilege, but whether you're an Ivy League grad or not, to repeat what you said for founders who might be listening and who are attempting the fundraising effort, project growth, do it with confidence, and know your numbers inside and out. And get that power suit on and show up in your full, fierce amazingness, because you have a lot to offer. And Laura Zibners was on at one point, and she is creating an intrauterine injection for estrogen and hormones. And really her tool, Calla Lily Healthcare, will be for many different things. But she was like, men, if their whatever wasn't working or it was leaking, they would fix it immediately. They would find the funding for it. Why can't we do the same for women's healthcare? Because that shit leaks. So we need that support behind all of these women's health initiatives. And we need men as allies to help us launch that forward. And also, as women, we need to minimize our timidness and being shy, because just like you and so many others, you are putting in this work to create something so powerful and so impactful for this up and coming generation, many generations. So I appreciate what you are doing.
Thank you. Your company is only as big as you imagine it to be, and your ambition is, and your grit to take it to the next level. So don't let anything shatter that. And have a close circle of founders who are a step ahead and a step behind, because it gets lonely, quite
It does.
frankly.
Mhm.
And it can be isolating in that, what do I do? You feel like you're the only person going through something. And likely one of those people either has, or they totally get it, what you're going through and what you're feeling, or they're there to celebrate the wins in a way that other people just don't understand sometimes. So having that network is really key for your own mental health as well.
Most definitely. Having been an entrepreneur myself, you're working in silos, you're working on an island sometime.
Yes.
And even though you are so disciplined and focused, it doesn't mean you have to shrink that ambition, and it doesn't mean you have to shrink that joy, because other people have been there, and
Exactly.
reaching out and also returning that
Yep.
to someone
Paying
else.
it.
And I appreciate you sharing that.
And just to know, we have amazing investors. I just want to throw out
Awesome.
there that it's not to bash investors by any means. You will find the ones. And from my second round of funding, I knew from a first meeting if they were someone who I wanted to continue pursuing or not, because you get that they get it in terms of what you're building, and you get if the two of you jive as well. And I think that that's really important. And most of our biggest investors are males. They get it. They support it. They care about the impact. They're not bringing their wives to meetings.
Most definitely. To really re-emphasize that point, so many guests that I have had on Redefine Her, they have said the exact same things. You find who believes in you, and that alignment is so powerful. That is true in our day-to-day in everything we do.
99 duds to find your stud.
There you go. I like that. Yes. I don't even need to say anything more on that, because that's perfect. Ovarian hormones impact nearly every system in the body. Sleep, mood, energy, muscle tone, even injury risk. Yet billions of people were never taught how to understand them. Aavia is changing that. By combining wearable data with how you actually feel, your mood, digestion, energy, and symptoms, Aavia predicts daily patterns, delivers personalized recommendations, and helps flag hormone conditions that can take years to diagnose in just months. This isn't tracking, it's hormonal intelligence. Download Aavia on the Apple App Store or Google Play and use Redefine Her to get 1 free month of Aavia's VIP experience. That's Aavia, AAVIA. It's not just women's health, it is public health. And women drive 80% of the healthcare decisions in their households. And mental health and chronic disease are leading drivers of healthcare spend right now. If corporations would follow the money, what do you think they would realize about hormone health?
Oh man, this is
Loaded.
Like, how much time do you have? You would find that, especially just speaking of corporations being big healthcare, also thinking about the employers who employ women as well. Hormone health is the foundation of everything. And so it can really be a driver of so many things. Mental health, it can be on the physical health side. So it impacts both mental and physical health. And you would see the improvement if you were willing to invest in it, in productivity of your employees, but then also in just costs overall, because you're doing more preventative things and also just considering it. So let's start training our doctors in medical school on hormone health. My co-founder, for example, had migraines where she would lose her vision every month or two. And doctors are looking for brain damage. They're looking for eye damage. They're looking for different disorders. Not one person asked her, when in your menstrual cycle does this happen?
Yeah, that's shocking. There's such limited training on hormone health and women's health overall. It's unfortunate, but that's opportunity to change. If you looked at a 16-year-old girl downloading Aavia in 10 years from now, what do you think is different about her life?
Oh my gosh. I think that she would have downloaded it much earlier than 16, unless that's when she was about to get her period for the first time. I think that her mother would have actually encouraged it because she's also been trained on the fact that, or father, both, honestly. Her parents would have been trained on the fact that this is something your child is going to go through. And so you should support them. They have almost a companion app, not necessarily sharing data, but sharing education on this is what your teenage daughter is going to be going through, or could be going through. Here's how to support her. And then for that person as well, she just knows that there's going to be so much stuff that is going to be happening to her beyond just bleeding every month. And because her parents were prepared, in school it's taught, the education in the app, all of the different elements together, just much more prepared, less confused, less things that are unexpected that are coming up.
Yes, and obviously more awareness, but less like we don't have to be shy about that either.
Yeah.
This is
No,
part
there's
of
already
our life.
this generation has less stigma, and turning 16 in 10 years will be Gen Alpha, not even Gen Z anymore. And Gen Alpha is actually already starting their periods.
I know, which is crazy. That's like what, 10, 12 years old?
I started mine at 10, and people are starting as early as 8 now. That is where there's just going to be less and less stigma with each, not even generation, but every 5 years. And also it's going to be a matter of what is going on in your household or with your friends, closeness to an older sister, whatever it may be as well.
So for people listening, where can they find Aavia?
You can find Aavia on Google Play or the App Store. And if you want to learn more, you can learn more on the pages there. But then also we have a website, aavia.io, where you can learn more. And if you're a doctor, also we have a physicians page there. Or if you're a brand that's looking to partner, we have a page for you there as well.
Amazing. So if you're listening to this episode of Redefine Her, share this with your girlfriends. Share it with your girlfriends in school and ask your parents if you are a student, young adolescent right now tuning in. But as leaders, business owners, founders, share this with the people in your life. This is really important. And the education and information is available. And let's do what we can to help this next generation take action and improve their own health care by really being present with it. We'd like to pass the mic forward on Redefine Her. And so our last guest left a question for you.
Ooh.
If if you could ask for anything, just one thing that would help you move whatever your top focus is right now
Oh,
to the next
wow.
level, what would that one thing be?
Ooh, if we could move any one thing. One of the things that you actually brought up yourself was if you were to have Aavia integrated into the healthcare system at large,
Yeah.
what would the impact be? So our goal is always, while having good business fundamentals, we only spend the money that we make at this point, just continuing to grow impact. And I do believe that a big part of that is partnering with the right partners throughout the healthcare system. If there were one thing to help us move the needle on that, would be a bird call to all the providers, servicers, products, brands to understand the impact we can have together so that we can really bring that impact to all of our members and patients and improve outcomes together.
Amazing. So call to the partners, call to providers and services that are currently helping women, get in touch with Aavia, because there is an opportunity to collaborate and create better access, awareness, and improve outcomes in healthcare. I have absolutely loved our conversation today. Aagya, thank you
too,
for
Brenda.
joining us. We will have all of this information on our show notes as well. And I very much look forward to sharing this. Thank
you
you
so much. I had so much fun today with you.
Me too. It was great to have you. Thank you so much for tuning in to Redefine Her today. It means a lot that you're here. If this conversation resonated with you, please be sure to like it and share it with your girlfriends, your partners, and anyone who needs to hear it. Yes, that includes our men who are allies as well. Don't forget to follow the Redefine Her podcast so you never miss an episode. This season, we're diving deep into real-life stories of bold women taking giant leaps of faith to create better access to legitimate care for all women. From the clinic to the boardroom, from lived experience to systemic change, these are the conversations that redefine what health and healing can look like. I'm your host, Brenda Armstrong. Thank you for being part of this community, and we'll see you next time.